Hi, my name is Jonas Schwartzman. I'm the Sustainability Manager at SPDM, affiliate institution, and it's a pleasure to be here sharing some of the work related to climate change through this case study. SPDM is one of the largest philanthropic institutions in Brazil, being responsible for managing around 150 healthcare services, including 17 hospitals. The services provided are part of the Brazilian public health system, called SUS, which already has in its principles universalization, equity, and integrality. The organization has a strong presence in the state of São Paulo, the most populous state in Brazil, with around 32,000 employees serving the last year around 16 million patients if you consider inpatient, outpatient care, exams, and high-cost drug delivery program. The work on climate change began in 2016 with the support of the senior leadership and the definition of strategic goals aiming at preparing greenhouse gases inventories using the GHG protocol calculation tool. In the same year, the organization promoted the first workshop Health and Climate Change and started joining the campaign Healthcare Climate Challenge. The awareness about climate change events, as well as the workshops on the use of calculation tool, were fundamental for the creation of a group committed to the development of the greenhouse gas inventories. The education and the use of the GHG inventory tool were coordinated by the hospital's environmental engineer and engaging different sectors to ensure quality and timeliness of data, including engineered building maintenance, clinical engineer, transport, hospitality, and pharmacy. Finally, the inventories are evaluated by the sustainability team and consolidated into a single institutional inventory. It's worth mentioning that having a clear goal, leadership support, and centralization of data was fundamental for the success. The first inventory, referring to 2015, consolidated information from 23 healthcare services managed by SPDM, and in the last version, referring to 2021, 37 inventories. The management of emissions over the years has enabled the development of institutional actions such as the significant reduction of emissions related to nitrous oxide, as well as the replacement of fluorescent lamps for LEDs. The actions developed by the local teams also had a significant impact on reducing emissions. The journey to reduce emissions is ongoing and experienced. The results are measured annually considering each care unit and on a consolidated basis. Individual assessment allows each service to evaluate its performance by scope, by type of issue over time. The consolidated inventory brings a perspective of measured changes that need to be developed in the institution to reduce emissions. In addition to inventory data, the institution established an indicator that evaluates emissions per full-time equivalent employee as a way of monitoring emissions. The use of this indicator allows the organization to be able to follow its evolution in emissions even with the entry or exit of health units in the inventory. Adopting the year 2018 as a base, there was a 46.7% reduction in emissions in tons of CO2 equivalent per full-time equivalent employee. In 2021, joining the Race to Zero marks a new phase of planning actions. After the work was implemented and based on the results of the last inventories, the institution verified that Scope 2 emissions, electricity, are standing out. In this sense, there is interest in developing, on a corporate basis, actions related to the acquisition of electricity from renewable sources in addition to challenges such as replacing obsolete equipment and developing actions along the supply chain. Certainly, funding sources and national policies are fundamental for the advancement of these projects. Thank you so much.